Good afternoon, everyone. Good afternoon, jury members. Thanks for this opportunity. Can you hear me properly?
Sure.
Okay. So, can you even see the thing which I have shared?
Not yet.
1 minute. I will share a screen. It's on the way. Anyway, I will start by the time. Basically, Kannur is a northern district in Kerala, and then I just wanted to showcase the way we initially handled the COVID scenario when actually the Kerala before and during the lockdown, before the unlock. Now during unlock, the scenarios have changed. Anyway, everyone of the jury members know it in depth. But during the lockdown, we were one of the best performing states, and then we actually did great. And we gave that time for the health machinery to build up the infrastructure, and also keeping the death rates low. And even till date, even though we have a high number of cases because very good testing is happening, our death rate is one of the lowest. So that is because the kind of help which police gave for the departments like administration and as well as health to prepare for all the things which are going to come, the infrastructure or medical facilities. So during that phase, like before this unlock 1 and unlock 2, the way we handled is the thing which I am going to present here in front of the jury members. It's all about the COVID and then COVID scenario in the Kannur district. So basically, we start something like this. We built certain verticals in our department, I mean, the police department. Police was interested with the job of quarantine ensuring, as well as ensuring the lockdown, as well as contact tracing. These three were actually given to the police department here in Kerala, and then we did it successfully. First thing is the tracking of commuters and collection of data. During lockdown, there was a strict prohibition on travel, and once they opened up the international flights as well as the domestic flights, we actually had an online portal by the government, and all the registration kiosks were opened at the borders. I have a border with Karnataka, so borders, as well as I had a district border where we used to enter the data. And then I have an airport, international airport at Kannur, where like primarily I used to get from UAE as well as some other GCC countries incoming flights. And I had a kiosk at the airport to enter the data, as well as I have a railway station and then railroad data. So like this, basically we had multiple data entry points where proper data was entered. And then I have a vertical opened under a narcotic cell, because like all our special cells were converted into COVID cells. So first line of verification cell was my narcotic cell, where basically I used to get the data here for last 24 hours, and then 0 hours to 0 hours I used to collect the data and validate it. Data in the terms of like the name of the person, from where is he coming from where is he going, what is the address of his house, and what is the phone number, how many people are there along with him, and who are there staying with in the quarantine. So once this data is at my desk, it's my job to ensure the quarantine, that is home quarantine. So to ensure the home quarantine, basically I gave it to my SDPOs, that is DYSPs, where what we did is we divided the whole district into small beats, police beats. And every policeman was given an area where he is the one who will take care of the quarantine along with the local samitis. We created the local panchayat member, the ward member, as well as one police constable, and some volunteers were tagged under the umbrella of police department. And this particular team was the one which used to ensure the quarantine. So what they will do is on the first day, the SHO or any sub-inspector will visit the house where this particular person has come. And in that house, we will first take the latitude, longitude of that house so that I can actually create a map. And then I will know how many people are the inmates in that particular house, as well as the phone numbers of those inmates, and even the phone number of the person who has come there. And also I used to print the stickers telling that this particular person is under quarantine, and gave it to the neighbors, not to that particular house. Usually we have seen that they will be posting it on the particular house, but here we did the ulta way, where the neighbors were alerted that the person who is staying next to you is a person who is under quarantine. So it has two advantages. One advantage is they used to inform the police if at all they were jumping any quarantine. And second thing is that community partnership came in, where all the household articles what they exactly wanted were delivered by the neighbors themselves. So neighbors used to help them by giving whatever the groceries and all. Even though online shops were not working, the neighbors helped them so that they would never need to come out of the house. That is the first thing. Second thing is, once the SHO himself checks and then warns him that we were having this Kido Kerala epidemic disease ordinance, where it empowered us to as well as cases those persons were jumping the contents, and or else they were were violating the government norms. So that we did, and then these police constables were given bikes, and fuel was given by the police department. Every day they have to visit this particular house and then take the count and the attendance, and they have to meet the neighbors and ensure whether this particular person is under quarantine. And the time fixed was also very much random. And then what we used to do is we used to have another control room, which actually used to cross check whether really our people have gone there or really they have done the check. So we used to directly call the person who is under quarantine and ask, did my policeman come to you today? And what is how is your health status? Something like that. So that we used to get the feedback directly from the ground. Also, we had another control room in my special branch, where if someone comes into my district, a video call with him, if he is having a WhatsApp or a Skype or something like that, and with his permission or with her permission, ladies will be dealt with lady constables, and males will be dealt with male constables. We'll ask them whether they are having any kind of problems, they need any assistance, or like police, they need any other kind of support, either mental support, or like many people used to enter into depression because they used to stay lonely. So our team used to call them and contact them and then help them to come out of any sort of depression. Like think that like a policeman is calling you and welcome to Kannur city, Kannur district. You are like really safe here. You should be under quarantine. If you need any help, we are going to provide. Even like police was having a home delivery system, Amrutam Kannur, where like we used to deliver home grocery items by collecting the money by our own police jeeps and all, only for those needy people. If they can afford to have their own online delivery system, we left it at that way. So both ways we used to like cover all the persons who are under home quarantine. This ensured that this is how actually all my 3 control rooms in the presentation help to do a 14 days quarantine check, and I had almost like 100% quarantine compliance. Then collection of primary and secondary contacts. Usually, like apart from this, if someone is like getting tested for COVID by the health department due to some symptoms or something else, we used to like first immediately get the tracking of the people who are like how he came, from where he came, what was his path, whom we met, and all. So immediately we used to come up with a quarantine check, contact checklist. Along with when I get this contact checklist, I used to prepare for a particular patient. One contact checklist was prepared here, and the contact persons were there. Primaries and secondaries were divided, and then immediately a call used to go from my control room telling them, see, you have come in contact with a particular person who has turned to be COVID positive, and then you need to be under quarantine and you need to take care, and then whatever the medical things or whatever we need to give them as an advice, we used to give. Then comes the compilation and presentation of data. We actually compiled everything in our central control room, where we had a master data. If any person turning out to be positive on some day, we used to like just search in the data, and then we will immediately get to know from where he has come, who are his contacts, where is he staying, who are there in his house, whom to quarantine, how to contact. Everything was like brought under a single umbrella. And then we had our cyber cell running 24 hours, where we used to track the persons under quarantine and then check whether they had jumped the quarantine or not. And then also we use the same kind of tracking to find out the contacts of the persons who had turned to be COVID positive. And then coming the strategy of containment. So when we had this, the latitude and longitude of the houses which were under quarantine, so everything was plotted on a map using Google Maps, and then we used to demarcate which area is having the highest number of cases and how to actually prevent it from spreading. And then using the Google map itself, we used to have a geofence, and then we used to actually fence the thing virtually, and then we used to pass the particular information and map to the local SHO. So local SHO used to go and then fence it physically, so that whoever or whichever area is under containment, it shall remain under as a containment area, and there is no jumping out of the containment area. So these like 4 steps we followed, and then we actually delayed the spike in the COVID cases. And the spike in the COVID cases happened only after unlock 4 started. And then till that time, we gave enough time for the medical and health people administration to prepare. And that's how we are now, even though we are having a high number of cases, we could actually bring down the death rates considerably, and we are really performing well in terms of the death rates. This is my presentation. Thank you all the panel members, and thank you, Coach, for giving me this opportunity. Thank you.
Okay. Good presentation, brief, to the point. Can you share your COVID graph with us in the district, how the things have moved in terms of your efforts, so that we can just see how.
Yeah. Let me just try that. Just give me a minute. I think I need to. Can I like I am not having on my desktop now. It is something else which I need to bring it here.
Okay.
Can I get that 5 minutes?
How
10
you
minutes of...
Okay, leave it. How you are doing vis-a-vis your neighboring districts?
Yeah. Everything I have. I just need where I can like.
Okay, if you don't have readily available, it will.
I can email. Just in 5 10.
Okay, no problem. Now, I would be more interested in knowing what is that. Anything special you will like to name which you have done in your district? Because we have been taking a lot of presentations, and most of the police people have done good job, and all of you have really followed the protocol or standard operating procedures and try to contain COVID. Anything special you will like to mention which you have done in your district? This we have heard. What you have said.
Sure. Basically, it's all about the community participation, and then mobilizing the local government machinery as well as volunteers. This is the actually local government in Kerala is really well-oiled machinery, which actually rose up to the occasion along with the police department. We had this Janamaitri police, that is community policing initiative which Kerala is having. So our policemen, the beat constable was already having all the details of the area, heads of the area, and those prominent persons in the area who are influencers for at the local level. So what we could easily...
Self-help groups also?
Yeah, basically we have this Kutumba Shri, that is a self-help group for the very marginalized ladies who are actually highly mobile. We created a small groups at the ward level, where one Kutumba Shri, that is a self-help group lady, was there, and one Gram Panchayat member was there, my policeman was there, and one health Asha worker was there. So this was a unique model where every one of them used to deliver their particular roles and responsibilities. Thus, we had actually very less number of cases during this lock period. And these people prevented anyone from jumping quarantine by ensuring, one is police, usually police ke dar ke wajah se, that is the fear of police and implementation of law and order. And then Asha workers used to deliver any health related queries at the doorsteps. And then Kutumba Shri used to deliver household articles or any other help which they need. And local Gram Panchayat member used to assign the houses I mean, if there is a poor fellow who can't afford quarantine, community quarantine centers were opened, and then he was like put in there at the ward level. So the multifaceted thing happened at the local ward level. We had this bottom up approach rather than having top up approach. So that's how the pressure from the people for not following the quarantine was ensured, that people were willingly having a work quarantine.
Okay, your death rate is lowest among the districts.
Yeah,
Are you
we have
claiming?
the lowest death rates. It's not the lowest, it is one of the lowest, because like if I can show in 1 minute, I can like show it online, because COVID-19 is having my district's data also, that online website. So in that I can easily show how my district fared. The graph also I can show. I just got an idea now. This is Kerala. And then my district is hope I can see my presentation.
Yeah, please.
This is Kannur. I mean, we have done enough testing, and then Kannur's graph will be. So I can like show this is a present scenario, but like I have my own graph, which I will show you after some time. That's what I said. I have my own graph. The per million population and all that particular thing I have, which I can share you, how it performed. Maybe I need some time, because like I was not really prepared for this
Okay,
presentation.
no problem.
Sorry from my side.
It's okay. Bhushanji?
Sir, I have actually your district figures at a very broad level. Your test positivity rate as of today is 10.8%, which is
Yes.
slightly, it's fairly high compared to the national
Yes.
average. So that is one concern. I also have your case fatality rate. It is 0.4%. There are districts in Kerala which are 0.1%, 0.2%. There are quite a few 0.4%. There are some which are 0.7%. I have these figures with me. Anyhow, I think some of your recovery rate is, if I'm not mistaken, around 63% or so approximately. So these are the figures which are available publicly right now.
Yes.
But more than that, you know, since you are managing and helping the health authorities, I think it's primarily the health authorities' responsibility to work out the proper statistics and data, because whatever you have done excellent as far as the efforts are concerned. But the measurement of the efforts is something which the health department should do more effectively. So what is the doubling rate? What is the the R naught figure, which keeps on changing? So you always work out over the last 7 days. How's the curve vis-a-vis the last 7 days, which is there, which is going up or coming down? So these are the things which also needs to be monitored. Apart from all the things which is done, there is a need and requirement to monitor some of these statistical things which will give us a direction that today our efforts, what are the results coming? Or not only the effort, it's the problem, whether it's growing or it's under control or in which area it needs more attention. I think those are the things which it can help to do. So I've been sharing some of these things earlier also, because there is a need to do more objective measurements. And I would like if those things are added. It's difficult to go back and add those things, but over the future, next few months, because this problem is going to continue. And unfortunately, Kerala over the last 2 weeks or 3 weeks have been galloping like anything. So as one of the key districts, I think You will have to work out and have these measurements also from the health department to be available to all the stakeholders so that they can work out more effective programs. So that's one thing which I would really like to share with you. Your initial efforts, I think, till the lockdown was there, or rather even after the lockdown, the problem actually started with some of the festivals which came up in the month of August, end of August or beginning September.
End.
Onam came up and a couple of other things, and that really spoiled the record of the excellent record of Kerala. That's what
What happened with you? I mean, all the application for this coach itself was based on my performance in the month of May, June, July.
That's right. It was excellent.
And,
Your May, June, July is excellent.
and data of that May, June, July was unmatched.
It is
We had reached a stage where we would be touching zero.
yes, I don't know. Yes,
Then
yes.
what the government policy itself changed.
That's right.
The current reflection of the cases is the post change of the government policy, where police was asked to withdraw from the lockdown strategy and all those things, where, like, you know better, like how the MHA guidelines as well as the state governments have unraveled. So
Yes.
then the role of police in all these things have reduced because there is no proper containment. Even though we say containment, Kerala is such thickly populated state where we market. So my presentation holds good only till the month of August 15th.
I fully agree.
In all cases.
Now, as an outside observer, what I have observed, and that is true for all the places, I don't know how far it is true for Kerala. See, we have relaxed our so-called lockdown norms. I think that was required to be done. That's perfectly okay. But the mistake that we did not enforce discipline like social distancing and the mask discipline. The problem what has happened today, people wear masks, but that is below their noses. People have social distancing, but at the same time, for 10 minutes, there is a social distancing, and for 20 minutes, they just don't bother. And it's actually a fatigue of lockdown which has now come up, which is creating this problem. Unfortunately, COVID is going to be there with us for another indefinite time, whether it is 3 months or 6 months, we do not know. What will be the efficacy of the vaccination, we really do not know. So this discipline of prevention, I think, will have to be implemented more strictly, and police will have to really take a very, very important role in that particular thing. But these directions definitely have to come from the top.
Yes, sir. Basically, it's all about police.
See, now they say everyone is at his own. So neither police is worried, no government is worried, no hospitals are worried. If you have something, you quarantine yourself at home and take care of yourself.
That's it. That's it.
Everyone at its own, but everyone should then have a discipline of wearing a mask. See, mask is not to prevent yourself. The mask is to prevent the other person, and people don't understand that.
Sir, it is like
they won't do anything, sir.
Helmet, sir. Basically, in helmet also, we are like trying to implement the 100% helmet compliance for two-wheelers since last 10-15 years.
We are unable to do that.
No one is doing it.
Yes.
Same way.
And you go to any European country or United States or any Western country, even a cyclist, even a 5-year-old person who is having a tricycle, he will be wearing a helmet. The small kid.
That is the difference.
Cycle itself. Yeah. It comes with the cycle.
Anyhow, thank you. I think you've done an excellent job. I really appreciate it.
Okay. Thank you.
Thank you. Thank you, sir. Thank you.
So thank you so much, Mr. Chandra. So we'll have another presentation that is from Prakasam District Police. I'd like to call Mr. Siddharth Kaushal, Superintendent of Police, for the project Sadbhavna. I request Mr. Chandra to stop his screen, or I'll do that.
I hope I'm audible there. Good afternoon to all present. Yeah, I'll share a presentation on the screen, sirs, so that